The second to the last question is for you to discuss about management of severe acute malnutrition in children. Okay, so they call that the SAM. Okay, severe acute malnutrition in children. So if you have this severe acute malnutrition in children, how do you actually manage it? Okay, so let's look at the structured overview of the severe acute malnutrition management in children. So first of all, you talk about how you confirm severe acute malnutrition. So if the weight for height is less than what 3SD of the World Health Organization growth standard, or the mid-arm circumference, which is the commonly used stuff in the clinics, okay, where you use the Shakir tape. So the mid-arm upper circumference, the mid-upper arm circumference is less than 11.5 centimeters, okay, or presence of what bilateral pitting edema. Okay, that's where you see there's severe acute malnutrition in the child. So management depends on whether the child has complications or the child is stable. Do you understand? So if the child has complication, it's an inpatient, you have to admit. If the child is stable, it's an outpatient. You can treat them from wherever they are. Now, inpatient management now, that's when you have severe acute malnutrition with complications. You have to stabilize the patient. So you treat and prevent hypoglycemia, like frequently feed them, monitor blood glucose. You can treat and prevent hypothermia, like keep them warm, avoid any exposure to cold environments and all of that. Treat dehydration cautiously. So use oral rehydration solution, that's for ORS, okay? And you don't use intravenous fluids except it is severe, there's a severe shock, okay? So correct electrolyte imbalance, okay, by potassium and magnesium supplementation. Avoid excess sodium, okay? So if there's any disease condition underneath, especially bacterial infections, use antibiotics, okay? Then you supplement micronutrients like the vitamin A's, the folic acid, the zinc, the multivitamins, and all of that. So transition phase, this is after you stabilize the patient. You start feeding them with F75 therapeutic milk, which has low protein, low sodium, and high carbohydrates. So you gradually move to F100, okay? Then rehabilitation phase, this is when you increase energy and protein intake for catch-up growth, okay? Then you introduce ready-to-use therapeutic foods, okay? Then you provide iron supplementation, okay? Then stimulate play and psychosocial support, okay? So outpatient management, you just treat them with ready-to-use therapeutic foods, okay? That's the F100 milk, okay? Also you can use the plum peas nut, okay, and all of that. So weekly follow-up for weight gains, edema resolution, and clinical monitoring. Treat minor infections, deworm the child, provide micronutrient supplementation. Then for the people that are caring for the child, you have to actually counsel them so that they understand, what is happening and the various signs that they should always pick up.